Hi everyone. This week, as we focus on prostate cancer and the impact it has on men, I'm very honored to have my mate Clinton with me, who shares his personal journey of surviving prostate cancer. Now, I acknowledge that it may not be easy for many to recount and openly share their experiences of cancer survival with others, as often it can be traumatic and confronting. I'm deeply grateful to Clinton for his willingness to give us a glimpse into his experience, in the hope that listeners may understand the importance of recognizing the risks earlier and to seek help and treatment soon as possible, because it may just save your life and the lives of your loved ones at risk of prostate cancer. Clinton has opted for an audio interview, so here is the podcast. Clinton, thank you so much for joining me today. And
my pleasure.
Yeah, and sharing your personal journey with your lived experience with prostate cancer is such an important topic for us to talk about, especially for Movember. We do have a few questions to get through that we'll share with our listeners.
Certainly.
So the first question I have here for you, Clinton, is can you share your personal journey of being diagnosed with prostate cancer?
Well, this is going back probably about 15 years ago. Mm-hmm. I used to get a 12-monthly blood test for the usual cholesterol and blood pressure pills, pills to keep you alive. At one time, I had a doctor in the city. She suggested to me one day at one consultation that I do have a PSA test. Anyway, when I went back probably a couple of weeks later to the surgery to arrange the blood test, etc., there was a relief doctor. She was very straightforward and said, well, before we do any blood tests, let me check first. So get up on the examining table,
yes,
drop your pants and lie on your side. Well, it was, you could hear the slap of, rubber gloves. And I thought, this is bringing back hilarious memories of watching movies type thing. But nevertheless, it's happening to me now. Yeah. Anyway, needless to say, she fiddled, or should I say, felt around. I probably went the show red as anything from embarrassment. Anyway, she said, we're going to get you checked out now. So I went for a PSA test, or blood test, I should say, to get for the PSA. Mm-hmm. She rang me when I was at work to say, I need to see you now. That was in the space of a couple of days.
Wow, okay.
She said, I'm making an appointment with a urologist. He will talk to you about all this. You need to speak to somebody soon. I thought that didn't quite put the fear of God into me, but I was a bit concerned. So the appointment was arranged. I went to this place. We spoke a while for a couple of times there. I did get another blood test from memory. And a couple of days later, he said, I booked you into Glengarry Hospital. We will take biopsies. I then come back and told my partner what was happening. So he took me to Glengarry Hospital, checked me in. I was there for day surgery. The results came back about 2 days later. It was on a Saturday. I distinctly remember that. It was a Saturday. And he was at the golf club. And he was having a fun time by the sound of it when he would telephone me. He was quite jocular about the whole thing. And I was quite taken aback when he said, yeah, mate, you got it.
Wow.
And he goes, yep, we did 8 biopsies and 6 of them were aggressive. Okay, we're going to do something about it now. One side of me said, I appreciate the fact that he told me straight away. The other side thought, well, that's very unprofessional. You're having a round of golf or having a few drinks at the bar and you're ringing and telling me, yeah, mate, you've got it. Anyway, I was then booked into QE2. It was early morning, quite early in the morning. I was talking to one of the male nurses there and he said to me, you're going to have a prostate removal. And I said, yeah. And I said, I don't know anything about it. What happens? This hadn't been explained to me by anybody. And he said, well, there's 2 ways they do it. One way is they cut you open, your stomach right open, they flap your belly open, and then they can attack it, cut it out. He said, otherwise, there's this new procedure now, with the robotic, or whatever they call it, I'm not sure, robotic. And he said, it's proving quite good. So that, I think I'll have that. Okay, he said, well, that's fine, okay. Now he said, anaesthetic and things like that. And I said, well, what do you recommend? And he said, I think you better have an epidural. Anyway, I was wheeled off to theatre and the young intern doctor was there. he said to me, "You're having an epidural." And I said, "Yes." He goes, "Okay. And a robotic one?" I said, "Yeah." Okay. He said, "All right, we'll get you ready for that." Okay. All right, so that's the last thing I remember. I came to in the ward and I had bits and pieces hanging off me and catheters and God knows what and everything else. It wasn't until the next morning when the surgeon, whom I presume did the operation, was on his rounds. Now, he had a bunch of interns with him as well, and they were asking questions. Now, and he said to me, "And who gave you the authority to have an epidural?" And I said, "I did." And he said, "I told them that you are not to have an epidural." And I said, "Well, nobody said that to me." And in that, he stormed out. In the meantime, when this was happening, the epidural needle moved in my back. I got to the complete stage where I was numb from my chest down to my feet. I couldn't feel a thing. And I said to the nursing sister, a male nursing sister there, and he was very kind, rather nice guy. Yeah. And I said to him, "I can't feel anything. He goes, "I can't feel my toes." Mm-hmm. And he said, "What do you mean you can't feel your toes?" I said, "I can't feel my toes." He pinched them and everything else. And I said, "It makes no difference." He goes, "We better get this epidural out." He said, "And I'm going to put you onto this morphine drip," or what do they call them? You self-administer, the ones there. Yeah. Which it turns out this is what the surgeon wanted all along. Mm. Anyway, he came in that evening and I told him what had happened and he wasn't very impressed. I was there for a couple of days. Before I was allowed to go, I had to drink a jug of water and pass it, which I did do with great difficulty. And you can't sit there and drink a jug of water. Mm. If it was a jug of wine, they'd have no problems. Nowadays, you try and drink a jug of water.
Oh, I know.
It's not easy.
Very uninspiring.
It is. I passed that, and they said, "You'll have a nurse will come around, like Silver Chain, will come to you for the next couple of weeks or week or so at your place and look after you." I was carrying an artificial bladder, so with a catheter, catheter still inside me.
Right.
Okay. And she said, "Well, you're okay to go." I thought, well, I've not been told anything at all. I need what do I do after I get out? Can I have a shower? Well, who showers me? I can't get in the bath like this. It was very lackadaisical, I thought. The nursing person came around, visited me quite often. The catheters then came out. I started using pads. They suggested pads. And then I was finding pads I was changing 2 or 3 times a day. Okay. Because, I couldn't control it. There was no muscle. I didn't have any muscle you couldn't control. Yeah. I went back and saw my local doctor, and she wasn't impressed with the procedure, what happened. There was no follow-up from QE2. I then used this balloon with a bladder strapped to my thigh. And I went back to work part-time with this thing strapped on me. So every time it was filling up, it was sloshing around. Oh. I literally had to go where I worked in Central Park. Luckily, I was on the ground floor, and I used the lift to go up to the first floor to the toilet so I could empty it out and start all over again. It was very inconvenient. I thought, surely this doesn't happen to all these people. Good. I remained incontinent for a number of years, despite the fact at one stage there, Royal Perth Hospital did get in touch with me to come in and see them, and then referred me on to Bentley Hospital to a physio. Right. And I started doing some exercises there, which helped a little bit, but nothing to any consequence. Mm. I probably kept Chemist Warehouse in business with tenner pads when they're on special. It was for a long time. 18 months ago, I got a call from Royal Perth Hospital. We're just going through some old files, and yours has not been written off, so to speak, How are you going with your incontinence? And I thought, must be an angel talking to you. Anyway, that's it. They booked me in. Come in and says, we want to have a look at this.
So this was 18 months ago. So how many years after this?
It's about 13 years.
Wow, that is incredible.
Yeah. I put up with it.
Yeah.
I suppose a lot of the blame there could be put up. I didn't pursue it, if you know what I mean.
I know. Yeah.
I just grinned and bared it. I didn't bear it, the embarrassing. But, I just put up with it.
Yeah.
And my family, or my friends who knew about it, my partner, just put up with it. A doctor, I think Lewinsky, I had an appointment with him, and he seemed to know what I was talking about. He seemed to think you've got no muscular control, there's something wrong there. Maybe a muscle was severed or something like that. Something happened with the initial operation. He put a camera down me. Oh, it wasn't very pleasant, but anyway, the staff, really good attitude, lovely attitude, nice people. He had a look around with this camera, and it showed nothing at all. There's nothing wrong with my bladder, except there was no muscular contractions. Anyway, I said, I'm going to fix this. And I thought, oh, praise the Lord, I hope so. He said, what I'm going to do, I'm going to cut into you again. I thought, oh, great. He said, I'm going to put a sheath. You put it on, you cut it under your scrotum. Yeah. You insert, or he puts a sheath on the penile. Yeah. This is medical talk. On the penile shaft. Yes. He said, now it may alleviate you, stop you, or it may not. 99% will stop you. I had that done just over 12 months ago. No problem at all. This is the guy that did this, Dr. Lewinsky. He's very well known, and he did an excellent job. He was a very caring professional. I thought very different to the ones I'd experienced a long time ago. So since then, I've been very, very lucky. It hasn't stopped completely and utterly. The idea is not to put too much pressure and strain on there. So if I lift anything very heavy, I might find there could be a bit of a problem there. But other than that, I've been quite good after that.
How did this whole experience make you feel? I mean, let's start off with the diagnosis to begin with.
The diagnosis,
with the phone call when it was just calling you from the golf club.
Well, because that's what I said to you. I felt whether he's tried to lighten the situation for me, I don't know, because you could see that I was scared.
Of course.
When they came back and said to me, we've done 8 biopsies and 6 were aggressive.
Yes.
Now, as you know, prostate is a silent disease. There's no pain. I never had the problems beforehand of actually having to go to the toilet 6 or 7 or 8, 10 times a night. On the doctor's initial checkup, when she said to me, I've known you all these years and I've looked after you for all these years, she said, it's about time you had something done, looked at it that way. Otherwise, I would have sailed, merrily along. Yeah. Because I said to you, there's no pain. You don't feel any pain. I think it's possibly like bowel cancer. I think unless you might have a niggle now and again, but there's no pain there.
There's no pain, no clear.
Yeah, so there's no, it's nothing as if you break out in hives or shingles or anything like that to indicate it's just a silent disease.
And that's why when they recommended you to have the PSA test, or I think that's called the prostate specific antigen test, it's so important for guys, it's recommended for guys above 50 to start including that as part of the blood test. Unfortunately, you had the digital rectal examination, which is highly uncomfortable and embarrassing for some guys. But
what did you do? Well, what we do? And
I'm not sure about this.
I remember there was blood on that. We had purple gloves. I still slapped them on. I still remember that.
That's a different level of trauma.
At least in the surgery, she did close the curtain.
Yeah. Fair enough. But I think the reassuring thing now we're trying to tell guys is that, you just need to go for your PSA, which is part of the blood test.
It's painless.
It's painless, exactly. So,
it's most important. You mentioned 50, and I would be bold enough to say that starting from 40.
Even 40, yeah.
Starting from 40.
Yeah, absolutely. Yeah. And catch it early,
Catch it early. So, if there's any signs of it, even an enlarged prostate.
Yes.
Because that's an indication of people going to the toilet, 4, 5, 6 times a night.
Yeah.
It's only a doctor's visit.
Yes.
And a blood test. Just sidetracking slightly. My youngest brother also had prostate, but he was actually operated differently. He was cut across the stomach,
right,
and folded back and cut out properly.
Okay.
He had no symptoms whatsoever, no problems after that whatsoever.
Yeah.
I do remember the urologist telling me that after this, I was sitting in his rooms, and he was telling me that after a prostate removal, there are several things that will change. For a start, the colour of your semen will not be the usual white thing, that people are used to. It will be probably clear, and seminal fluid will be clear. There could be a slight amount of peeing as well, that sort of thing. You will lose a lot of libido. And jokingly, I said to him, well, I'll just keep mowing the lawn. I'll get my jollies mowing the lawn, thank you. I jokingly said that,
There's a little bit of a buzz in that,
Yeah. I'll just mow the lawn.
Yeah. Oh, dearie me. But it's good that he went through what to expect and what to prepare yourself.
That was a part of a very short conversation. Yeah.
In hindsight, do you think there should have been more support? Because from what I hear, there was no proper debrief, or even leading up to the surgery.
There was no briefing or debriefing.
Yeah, there was. Yeah, correct. Which has been really traumatic for you. You know what I mean?
When I look back on it now, and I thought, am I a victim of the public system, or am I just a victim of the? I'm just a victim, just a one-off or whatever. You hear of everybody, other people having prostate problems and no hassle at all.
Yeah,
I have had a lot of support from some close friends.
Yeah,
and my
so tell me about your support system. I mean, how did they take the news to begin with?
I remember talking to a couple of travel agents. I've been to a travel function after I was diagnosed.
Yeah,
where I mentioned to a couple of agents that I'd known for many, many years. Okay, and I could virtually talk to them in confidence. And they've always, when I've seen them ever since, have asked me how I've got along and that sort of thing. I've told them.
Yeah.
And they've supported me and said, insofar as, look after yourself and that sort of thing. It's not as if I've been shunned or anything like that. I have had a lot of support from my family. In fact, my sister-in-law, she tended me a bit like the silver chain. She looked after me for a while, when I had these carrying these bags and God knows what else. She was good with assistance because she worked on several wards at Royal Perth Hospital. I must tell you that there was no pain attached to this.
Yes.
It wasn't painful at all.
To the site of the surgery. Yeah.
It wasn't painful at all. It was painful into my brain, but into my mind. It was annoying because I had to be careful if I went anywhere that I could actually empty this bag out somewhere.
Yeah.
Privately.
Yes.
Not just sort of go behind a bush and just empty it out and come back into the party type of thing.
Yeah. There's a lot of planning, isn't it? Yeah. And that would have stressed you out.
There was a couple of times I got quite embarrassed when the balloon actually came off.
Oh, okay.
And it wasn't sort of I'd pee when I wanted to pee. It was just turn the tap on and just let it keep going, that sort of thing.
Yeah. So is incontinence one of the after effects of the prostate removal, or was it a unique situation for you?
It couldn't quite be unique because, as I said to my brother, my youngest brother had it. He had no problems whatsoever.
Didn't have that. Yeah, okay.
It might have been just unique to myself. Other people might have had it. I don't know. I've never inquired. I don't know, Simon.
Yeah. I'll find out a little bit more about it, but I think it's so important, therefore, what I take from your narrative, which is, I'm really very thankful for you for being so candid, with the whole journey, because, it really demonstrates, when you are dealt with a piece of news like that, which is traumatic and scary to begin with, and the way it was being delivered to you, it's quite offensive, really.
The way it was delivered to me was not what I would have thought.
No, correct, yeah. And then through the whole process of not being informed of every single step.
Never briefed on that.
Never, yeah.
Except by a nursing staff.
Yeah.
And then to be confronted by the surgeon himself to saying, well, I didn't say that, I didn't told you not to do that and everything else. Well, I'm sitting here and saying, well, you never said anything to me about it, what I was supposed to do.
Yeah. So what would you advise guys? Obviously with this interview, we're trying to get guys to be comfortable enough to go for a test for PSA and not be fearful of the whole process of the diagnosis. What would you encourage them to do to make sure that they do have a good experience with treatment?
First of all, it's painless, in inverted commas, is that it's a blood test. And the only pain is when the needle goes in to take the blood out.
Yeah.
There's no hassle there.
Yeah.
You might as well get it done at the same time as you're getting your cholesterol and your blood pressure and all that, your liver and your kidneys. Get it all done at the same time. Include the PSA into it, okay? Because then the doctor can come back to you and tell you, well, there's a slight touch there, or there is an alarming level, or there might be a mid-level or something like that, of we need to have a look at this further. Just because the PSA is up doesn't mean to say you've got it. It could be sort of, an indication that there is a very likelihood that you may have it at the beginnings of it, or you may have it already, or you could be susceptible to it. There was no history as far other than my younger brother. There was no history that I was aware of in our family of it. But then again, going back when I was a youngster, back in the 50s and beyond that, when men passed away or something or other, it was put down to cancer. Or they died in their sleep or something like that, or a heart attack. That nobody knew about prostate cancer then. Yeah. As I said to you before, and you know that, it's a silent disease. It can kill you. I've always thought, and I don't know, I could never have proved it. I didn't want to prove it anyways. When my father passed away, he passed away on a Sunday morning in bed. My mother rang and told me later during the day that he passed away. He just moaned and groaned, so to speak, and rolled over and passed away. Now, he was only 70 and he lived an active life, a working life. He was not retired. And I always thought afterwards, it's a possibility he might have had it. And of course, in those days, you never had those things. Guys in those days always joked about people who had incontinence, because usually they'd go to the pub and somebody would sit there and wet their pants. And it was jocular and just put to one side, never thought about it. If a woman had been diagnosed with breast cancer, all hell would have broken loose. But if guys didn't talk about it, and I think the situation is now, it's still a lot of people don't talk about it or won't talk about it or are frightened to talk about it because of, their so-called manliness. And I think it's changing. The mood of people's thoughts of, to get things done. I think it's changing. The ages are coming down. People are being more open about lots of things, whereas you never talked about them 50 years ago.
Absolutely.
The help I had from my family was good. The structure of the help, if it was a structure you would put in with my friends who knew about it, they were always there to support me.
In terms of communication with health professionals through this journey, and based on your experience, what would you advise guys to make sure of when they're communicating?
Make sure that they ask their health professional, what's going to be involved for me? Will I be able to get an erection? Can I have sex? Because that's what it is. It's just right down in that area.
Correct.
And, ask. Don't be frightened to ask. Are there different types of surgery? Ask your professionals what sort of treatments are available. Do they have a recommendation? But also take into effect my consideration.
Any trauma that we experience to our physical health has got a direct impact on mental health. So how are you feeling today?
I'm feeling good.
All this good.
Since I've seen you since then, I've had the prostate. I'm 74 now. I'm quite happy in my life.
That's awesome.
Yeah.
That's awesome.
I get up and quite often in the mornings like this, I go start singing on the backyard, It's a beautiful morning or it's a beautiful day from Oklahoma or something like that, And I get the people yelling over there, oh, shut up, Clinton. People over the back and the people over that corner over there, they love karaoke over there.
Yeah.
And I know them quite well. Sometimes they might on a Saturday evening, they'll start singing away, then I go in the back and we start singing along with them,
That's amazing.
But it's life is good to us.
Good. Good.
Life has treated us very well.
Thank you so much for sharing your story.
Anything else in there that I might be able to help you with?
No, I think you've covered it all pretty well, because I think what is so important and endearing about your story is that it didn't turn out the way that it should have by textbook, as you say. And the trauma itself is an experience that I don't think you would wish it on anyone.
No.
But I think the learning curve from that is what you get to share with others, and your advice towards the end where you said, what are the steps that you really need to follow, right from testing to diagnosis to treatment, and have very clear communication with the health professional.
Yes.
Because without that clarity, it will just increase your anxiety.
Yeah.
So it's important to know what to expect,
Yeah.
and also to find out what support systems there are along the way. And as you mentioned earlier, that might include having depression, because the process itself can be traumatic. So the person may experience some kind of depression or anxiety after that. And to get that support as well, which really it's nothing to be ashamed of.
No.
Thank you.
My pleasure.
Thank
you, Simon.
No, it's my pleasure. And I really hope that the listeners of my Movember campaign will take, some really important information from this conversation.
Please
with
do.
them and, encourage the fellas in their lives, their dads, their brothers, their uncles, their partners, their colleagues to go for the test. As you say, even at the age of 40 onwards, as part of their blood test. And that because they could just possibly save their life.
Well, even young people, 25, 30 or something or rather might say to Dad, go and get that test. Yeah. Oh, yeah, I'll think about it. No. Go and get that bloody test. Because there would be guys out there in their 50s, 60s and 70s. No, 70s getting old, but nevertheless, if you've got it aggressively at 70 or something or rather, you might live to 71, 72, 73. But, if you can get something done about it, you might live to 95.
Exactly.
And you might get a telegram from the king. I'll be King William by then.
Well, I hope the king does get his PSA test done as well, to be honest.